As of yesterday's report, I'll just go by yesterday's report, Dimapur is contributing to 50% of the Nagaland's cases. As of now, we are having 3,193. Then in that, recovered is 2,394, so recovery rate is also very good. And asymptomatic, we're having 723, so most of them are in home quarantine and some of them are in COVID care centers. And we have very few which are symptomatic, so around 4 to 5 of them are in the COVID hospital who are undergoing active treatment. So most of them are also having all mild symptoms only. Most of the cases in Nagaland, or what we are seeing now, is most of them are asymptomatic. Only when they get themselves tested, they come to know their status. Most of them don't have any symptoms also. So one thing is that most of this we are seeing in the younger age group, below 30s. If you go by the statistics also, most of them are in the 25 to 30 age category only. So luckily for us in Nagaland, most of them are asymptomatic, and the recovery rate, from the recovery rate also you can see, if 3,193 is there, then 2,395 is almost recovered. That's, you can see, more than 60 to 70% has recovered. So what I would say is that no one knows now whether you're having the virus or not. Most of them are asymptomatic. So if you are coming from a high-risk area like that, from the red zone, or if you feel that you have been exposed, then get yourself tested. That's what I would suggest also. Home quarantine, when they go home, we give them a certificate, and then they have to download all this COVID-19 Nagaland government app like that, and then we give them our control room numbers. So our control room also get their numbers. We get up all the details, the contact number, everything. So one is active surveillance and one is passive surveillance. So active surveillance are those patients who have recovered, or we do a lot of contact tracing also. So if suppose Mr. A is positive, so all his close contacts, so we have some high risk, low risk, and all these categories are there. So according to that, we do all the contact tracing. When we do all this contact tracing and all these things, we take all the names, the line listing is there, the contact number, the address, everything is there. So on this, some are put under home quarantine. So for them, from the call center, control room, we will give a call every day for active surveillance, and for passive surveillance after every 3 days like that. If you reopen the schools also, there will be so many things. So I think we should wait for some time, at least this year, because you never know, again, because children again are more vulnerable, that below 10 years and above 60 years, they come in that category. So I don't know about the government policy. Some are saying they'll be opening up from 1st November like that, but again, it depends on the local situations also. Are we following all the norms or not? That's another thing. So most of the death that has been happening as of now, it's almost all the patients were having some comorbidities. Some of them were cancer patients, some of them were having some kidney problem, some were diabetic, hypertensive, then alcoholic liver diseases they were having. Like that now, all with some comorbidity, and as we all know, with all this comorbidity, their immune system is down. So when their immune system is down, means they are more susceptible for all these infections, for this COVID. So in that process, they got that COVID, COVID-19 positive. So exactly because of this, it's very few. You can say nil, because almost all the deaths that has been happening are all with comorbidities.
All or?
Mostly, most of them, all.
90%.
Yeah. Only 99% I can say. So far we have been doing some death reviews, some 14 deaths like that. So almost all of them were having comorbidities. We are seeing now the trend. What we are seeing is most of the cases which are seeing is above Purana Bazaar in Dimapur area, like in 3rd mile, 4th mile, Chumu area, Singrijan, here and there scattered. And now we are observing some in the Dimapur town area also, like some in Duncan, and here and there Burma scattered like that. So if this trend goes on, I think if we are not very careful, I think it may increase because of the people's mobility, and then they are not following all the norms also. Most of them are not wearing masks. The social distancing is not being observed also. Herd immunity to take place, I think according to the books, the 50% of the population has to get infected. So see, Nagaland, according to statistics, how many lakhs population we are having, or Dimapur for that matter. Dimapur population will be roughly around 3 to 4 lakhs. So 2 lakhs have to get infected. So again, that is a very difficult thing. So right now, what I should say is that to the public is that we have to be very careful, wear masks, not be very complacent, then as much as possible avoid going out and going to crowded places also. And even if you have to go to the marketplace and all like that, it is unavoidable. Be very careful like that, especially when you're going out, touching the railings and touching all these things. Then when you come back home, wash your hands properly. Then if the clothing has to be washed, then take a bath like that. Like personal hygiene has to be maintained also. You have to observe all the 3 C's and 3 W's and all like that. Wearing your mask. Wearing mask is very important. Social distancing is very important. Then washing your hands and all these things are these are the 3 basic things. But as of now, what I see now, after all this relaxation and all these things, after September, from September, everything has been relaxed now. So people seem to be very complacent. So they've forgotten how to wear the mask also. Most of them are just hanging it over their neck like that, like on some decoration. Then in the marketplace also we don't see any social distancing. It's back to normal for many of us. So then in the auto rickshaw also, so many things the government is also doing. Like there should only be 1 passenger, but again same thing, where so much overcrowding is seen. So the government also cannot enforce on all of us. No? So it's up to the public. If you want to be safe, if you want to be protected, please follow all this. All these precautions, wearing masks, social distancing, and then avoiding all these crowded places, close contacts. I think this, if we observe all this, it will really help us, because I think this virus is going to stay with us for a few more months or years. We cannot say anything about that. So that's the only message which I want to give to the public.